No Brasil, há cerca
The
de
population of Brazil is about 207.7 million, and it is estimated that there are about 13 million people carrying rare diseases. There are 6,000 to 8,000 types of rare diseases, of which 30% of patients die before the age of 5. 75% of them affect children, and 80% are genetic. Currently, there are around 240 services in Brazil that offer assistance and diagnostic services. However, because these are rare diseases, often they are diagnosed late. In addition, patients generally encounter difficulties in getting access to treatment. In 2011, the Daher family was added to these statistics when they received the news that their eldest son was affected by mucopolysaccharidosis, Hunter syndrome. And so began Antoine Daher's fight against time.
I fought so hard to find out more about my son's illness. Our fight took about 3.5 years. We had a suspicion of a disease, but we could not discover what it was. It took us 3.5 years to finally find out about Anthony's disease, which sometimes might take people even 7 to 8 years to find out, and that's very late. Tony Daher is really that person, right? He has been the lead player of the countless gains for the rare diseases cause, and it is really his work. All that he has achieved to bring together in Casa Hunter and the partnerships that Casa Hunter has established, they bring about a real revolution in terms of how rare diseases are approached in our country. My greatest compliments to the action that the institution coordinates, Casa Hunter, and tell Antoine Daher to continue with the persistence as always, developing his mission of vocational characteristics that I can testify that has helped a great deal in creating awareness among the Brazilian population. Doctors, government authorities regarding the vicissitudes, difficulties, and support needed by people with rare diseases in Brazil.
Another result of the partnership between Instituto de Genética para Todos and Casa Hunter is the work regarding gene therapy, aimed to correct a genetic defect or a mutation that the patient has that may result in the cure of mucopolysaccharidosis.
Gene therapy, we believe, may be a cure for mucopolysaccharidosis.
Day Hunter consists of multidisciplinary care for patients with genetic diseases with or without a clinical diagnosis. This method deepens the vertical knowledge that integrates and contributes to the knowledge of the team, besides benefiting the patient as an individual and his or her health care needs.
For me, I did not consider treating patients with an inborn error of metabolism in an interdisciplinary way. I did not have a nutritionist at my side, or a speech therapist, a nurse who does collections, medications, those things. It was very important having a group of psychologists and occupational therapists with those professionals that improve the quality of life of the patient. We doctors only give the diagnosis. Who cares for the quality of life of the patients are non-doctors, right?
The project assists families who are in social vulnerability situations through financial support for equipment purchase, psychological assistance, dental care, and means for the patient with a rare disease to consult a specialist. The House of the Rare will be the first in a series of similar centers to be deployed across the country, with the objective of establishing an interconnected network of comprehensive care for people with rare diseases and whose general objective is the promotion of comprehensive, multidisciplinary, and qualified assistance to people with rare diseases and their families. The Hunter test, also known as the heel prick, is done in the neonatal screening program for the early diagnosis of rare disease patients. Continuous education is to provide training of new practices and the development of skills, as well as technical scientific updating and the revision of routines, procedures, and the use of technologies. Our participation in public health policies is about experiences in healthcare carried out in other countries, states, and municipalities, as well as to expand the training and the level of participation of various groups that work with health.
Today, for me, all the children who come with their parents and look for the Casa Hunter for any kind of help, I can only see Anthony in them. It began as Anthony's father. Today I've become the father of all those children who knock on Casa Hunter's door.